of national health insurance has been a topic of discussion for decades now. While past and present governments both agree that the need for national health insurance is a must, they've differed on how to get there. Well, recently, the Minister of Health, Dr. the Honorable Duane addressed the issue during the weekly meeting of the Rotary Club of New Providence, where he not only addressed health care, but national health insurance.
Honorable Dr. Duane E. Sands.
Thank you. Please be seated. I wondered what I would talk to you about tonight. I ought to try and tackle a subject that is incredibly confusing, has been the source of consternation and debate, comments going back and forth. But I need to frame it so that you understand how we got to where we are. So let me start with a text that I got tonight. And it said, Dr. Sands, I want you to know that we have 31 patients waiting in the emergency room to be admitted, and there are no beds. 31 patients. Add to that the fact that we have 24 boarders in the hospital who have been there, each of them, for at least a year. Some of these are patients that were born in Princess Margaret Hospital and have never gone home. Some of them have been there for 10 years, 15 years, some longer than that. Now you may ask, how does a country, which is the wealthiest country in the Caribbean, have some of the challenges that we have? Depending on whose numbers you read, our GDP per capita is anywhere between $21,000 and $30,000 per annum. And by any stretch of the imagination, we are a wealthy country, and so we ought to be doing reasonably well. But there are some peculiarities about the Bahamas and Bahamians that explain why we are where we are, and I'd like to outline some of them. The first is that we are a procreating people. Now, we don't admit that we like to procreate, but we do. But as soon as a child is born, that perfect child, we begin the process of damaging or destroying because of our concept of what constitutes beauty. And so a typical child in the Bahamas is considered to be abused unless they got 3 chins, right? You know, the big, fat, juicy baby. And that continues in the way we treat our children to the point where we have an epidemic of obesity amongst our 10-year-olds, our 12-year-olds, and our teenagers. When we look at the difference between 1989 and 2012, give or take, we have seen a 500% increase, 500% increase in the amount of our children that are obese, with the consequence of hypertension and diabetes in our teenagers. That continues through adolescence and adulthood because of our view that if you ain't solid, you ain't saying nothing, right? So 79.6% of us, including me, and I know I look good, but including me, are overweight or obese. 49, or roughly 50%, 1 in 2 of us, are obese, with the consequent health care issues that come with that. I mentioned that we like to procreate. When we procreate, clearly it involves skin on skin, direct contact, and we spread more than love. And so in this country, we happen to have the highest incidence of HIV/AIDS anywhere in the world outside of sub-Saharan Africa. So 1 in 50 Bahamians, or 2% of Bahamians, are HIV positive. 1 in 50. That compares horribly to the incidence of HIV/AIDS anywhere else in the region. And we add to that a social stigma of the most vulnerable people. That would be men that have sex with men, commercial sex workers, and others, such that those people who would ordinarily seek health care are denied health care on the basis of our prejudices. Let's shift gears to the other problem, and that is cancer. While it is easy to say that there seems to be some environmental issue, there is no evidence that there is an environmental factor. What we do have is a genetic factor, particularly as it relates to the carriage of a particular gene, the BRCA1 and BRCA2 gene, that leads to our women getting breast cancer and ovarian cancer at a very, very early age and at a very advanced stage. We also have challenges that lead us to have the highest incidence of diabetes in the world. In the world, number one, the highest incidence of diabetes anywhere in the globe is in the Bahamas, okay? I mentioned obesity, we're number 6. Hypertension, we have the worst hypertension in the region, certainly in the Americas. And when we put it all together, we are a very, very sick people. My grandmother used to say, if you like it, let it kill you. And the problem is that with our affluence, we have adopted behaviors that have led to huge challenges with illness. The last time I spoke in this forum, I gave a talk on violence and the impact of violence on the healthcare status of Bahamians, and I want to just speak briefly to that right now. For more than 20 years, we have been identified as one of the most violent countries in the world. And while we like to moan about somebody got to do something about the shootings and the stabbings and so on and so forth, this has been an issue certainly at least since 2000 and perhaps before. When we looked at the statistics that are collected in the emergency department at Princess Margaret Hospital, the Rand Memorial Hospital, and Doctors Hospital, and we look at the number of assaults, stabbings, and shootings, we realize that the number of assaults of Bahamians on Bahamians is 3 times higher than the average number of assaults in the United States. When we look at the number of shootings and fatal shootings now, we are ranked, depending on the year, anywhere between number 10 and number 11 in the world. Now, that does not consider the impact of our healthcare services on victims. And so if you were to adjust the number of people that don't die because EMS gets to them in time, or the emergency room team or the surgical team gets to them in time, the number would be significantly higher, and we would probably be somewhere closer to number 1. Now that is a dubious distinction, and it is a distinction that explains why, when we put this all together now, our healthcare system is challenged. Add to that the fact that we are not a single landmass, but we are an archipelago of many different inhabited islands, many of whom are trying to play catch up to New Providence with the health challenges that exist in Abaco, in Grand Bahama, in Eleuthera, and Exuma. And you find yourself not having to have a single healthcare facility, but you have to multiply healthcare facilities up and down the chain. So we have 105 clinics or hospitals throughout the Bahamas. You also have to determine how you're going to staff them, how you're going to do diagnostics, how you're going to provide medication. And there is the concept that all Bahamians ought to be entitled to a comparable level of health care. I want you to take all the things that I've just said and shake that up. And it explains why we are where we are. Is it a matter of money? The truth of the matter is that as a people, we spend about $2,500 per person per year. If you multiply that times our population, it works out to about $800 million per year, which works out to about 9% of GDP, 10% of GDP, which puts us as near the top of spend per capita of any country in the world. Actually, we're about number 30, 35 in terms of the dollar amount that we spend per person per year. The return that we get, on the other hand, ranks us at about 140 out of 191 countries when we look at the quality of health or the level of health of Bahamians. And so it is against this backdrop that the national health insurance discussion started. People looked at the challenge that many people have with accessing health and determined that since there was only about 30 or 40% of people that have access to health insurance, that maybe the solution was, let's get everybody insured. Let's throw some more money at the problem. And so back in the 1970s, about 1978, the discussion about national health insurance started in earnest. The discussion was led by a group of very eminent persons, including the now deceased Dr. B.J. Nottage, Dr. Perry Gomez, who was a young physician at the time, Ruth Miller, and a number of other people. And they formed a working group to look at the introduction of national health insurance as a social program to deal with the health challenges in the Bahamas. There was significant opposition that came from the medical professionals, not so much on the principle of NHI at the time, but the way it was intended to be rolled out. Let's move along to the year 2002, when the then Progressive Liberal Party administration announced to the nation that a Blue Ribbon Commission would be formed, and that Blue Ribbon Commission would look into the development of a product called national health insurance that would provide for coverage for Bahamians to minimize financial ruin as a result of health problems. I was a surgeon in the Princess Margaret Hospital at the time. I was happy to announce that I was non-aligned. As a matter of fact, they used to call me a PLP doctor in those days. And I saw the findings of the Blue Ribbon Commission. And I decided to open my big mouth and say, well, you know, this is wonderful, but this ain't awake. Because what was intended with that product would not, in my opinion, have addressed the fundamental challenges of healthcare issues in the Bahamas. That led to some serious back and forth, and that led to recrimination, name calling, etc. And it is ultimately what caused me to get involved in politics in the first place. I can remember it distinctly. It was one morning, it was a Thursday morning. The show was Issues of the Day. At that time, it was hosted by Jeff Lloyd, 94.9 FM, More FM. I and Dr. Robin Roberts were the guests on that show. And we were explaining why we didn't believe that the NHI program was going to work. Count them, 4 cabinet ministers called into the show to explain why we were non-patriots, why we were horrible, greedy physicians, and why NHI was not only going to be effective, but it was going to be the basis of the platform that was going to win the 2007 election. I put on a red shirt that day, and I guess the rest is history. The 2007 election, as you know, was won by a different political organization, which was then ousted in 2012, and then the conversation started again. Now, on April the 24th, 2017, National Health Insurance services were rolled out to the Bahamian public. That is roughly 2.5 weeks prior to the general election. National Health Insurance, as promised, after multiple consultations and a lot of money spent, was going to provide on an annual basis $100 million worth of primary health care services and roughly $25 million of catastrophic health care services. May the 10th didn't turn out so well for the incumbent government. And then subsequent to May the 10th, and I don't know whether this is a vote of confidence or not, but the Prime Minister asked me if I would head the Ministry of Health. And so National Health Insurance became a part of my portfolio. Now, it's very interesting, when we did the budget, we realized that we could not afford $126 or $125 million for NHI, given the fact that we realized that we would have deficit spending to the tune of $400 million to pay for unpaid bills in fiscal year 2016-2017, and another $300+ million moving forward that had already been committed. But we had campaigned on a platform that said that we would retain national health insurance. And so the Minister of Finance and the entire cabinet agreed that we would maintain NHI, but that we would reduce the budget slightly, and we would cut it from $126 million to $40 million. $40 million total for the entire program. There are some legacy challenges with national health insurance that you've probably been reading about every single day. And I'd like to go through some of them right now so you can understand why we're having this discussion. On April the 24th, 2017, the National Health Insurance Act had already been passed. And the National Health Insurance Act said that in order for the government of the Bahamas to provide national health insurance benefits, there had to be a National Health Insurance Authority. In order for there to be a National Health Insurance Authority, there had to be a board. Well, the board was never appointed, and no staff had ever been seconded to NHI. The secretariat that existed had individuals from health, from the Office of the Prime Minister, from National Insurance, from the Ministry of Education, etc. And bills were being paid out of the budget of the Prime Minister's office, out of NIB, out of health, out of the Attorney General's office, etc. Subsequent to July 1st, the National Health Insurance budget now falls in the Ministry of Health. But the law says that in order for us to pay benefits, there has to be several things. We have to have a board, which doesn't exist. We have to have an authority, which doesn't exist. That there have to be contracts and there have to be regulators of or insurance providers, which have not been contracted. There are physicians that have been contracted, and there are patients that have signed up. Thus far, 25,000 of them. But no pharmacy has signed on, and only a few laboratories have signed on. So here's the scenario now. There are persons that are expecting certain services. They go to a clinician, they see the clinician, and a problem may be identified. If that can be managed in the outpatient setting, not a problem. But let's say somebody's identified to have a heart problem, or somebody's identified to have signs and symptoms of cancer, or to have one of the other problems that I outlined. If they do not have the means, then they now have to enter the public healthcare system. A number of the physicians that are providing NHI services are not a part of the public healthcare system. So they don't have any admitting privileges, they don't have any prescribing privileges in the public healthcare system. And so, if you were seen by one of these physicians, you would now have to be sent to a public doctor to then be plugged into the system. I mentioned that we didn't have any pharmacy services because no pharmaceutical company, no drugstore has signed on to NHI to date. So you couldn't get any medication. So of the 25,000 people that are receiving NHI benefits right now, they are in kind of clinical limbo, as it were. There have been calls for us to shut the program down. Bahamas Insurance Association have said that there are legal issues because the NHI Secretariat is acting as an insurance company, and that is in violation both of the NHI Act and the Insurance Act. Now, I've always said that if you put two lawyers in the same room, you're going to get two different opinions. And so the question is, how do we fix this problem? Interestingly, NHI is a big, big conversation, but think about it. $40 million over $840 million is less than 5%. So NHI, as a portion of the healthcare spend, is a minuscule part of the spend, less than 5%. And yet it consumes 75% of our conversation. Now, as I get ready to wrap up, I will tell you what is going to happen. I believe, because somebody told me, that we should soon see the Gazette that outlines the boards for the appointment of the chairman, the deputy chairman, and the board of directors of the National Health Insurance Authority. Immediately as soon as they are announced, we can begin the process of regularizing the governance and corporate structure of NHI. I believe that NHI has an amazing opportunity to begin the process of radically reforming our inefficient, wasteful healthcare system. It is estimated that we waste about 25% of the spend on healthcare in the Bahamas. So if you say that we're spending roughly between government spend and self-spend, we're probably wasting about $125, $150 million a year, waste. Other people might use some stronger terms that I'll call it waste. NHI has the opportunity of realigning strategies and processes such that we can now modify our approach to healthcare in a way that provides value for patients, in a way that becomes patient-centered, and in a way that takes the battle out of the hospitals and into the streets. Meaning that we have to focus on the community clinics and the primary care setting, but simultaneously we have to acknowledge that many of our people are well advanced on their way to dying. And so a primary care strategy alone is not going to fix our problem. That's the reason why our focus is going to be primary care on the one hand and catastrophic care on the other. If you don't provide a catastrophic care component, you are going to write off huge amounts of your population. The Pan American Health Organization in 2007 predicted that there was going to be a 300% increase in deaths of Bahamians and other Caribbean nationals, given the challenge of CNCDs, chronic non-communicable diseases, from 2007 to 2027. 300% increase, which means that our mothers and fathers and brothers and sisters will be dropping down like flies from heart disease, from strokes, from kidney failure, etc. And ladies and gentlemen, understand that we can never pay our way out of this mess. There is no way that we're going to pay our way or ensure our way out of this problem. We've got to do things differently. We have to adopt a totally different strategy, and it has to incorporate prevention, health education, and wellness. It may sound simple, but we got to start eating right. We got to start exercising. We got to realize that no, you're not solid, you fat. Okay? No, you're not big bone, you fat. Okay? Now, that is not to say that people should not have self-esteem. That's not the point. It is to call it what it is and to understand that with every increase in BMI, you increase your risk of dying from cancer, of heart disease, of stroke, of kidney failure, etc. The other thing that we need to realize is that we need to become self-sufficient in our approach to healthcare. And that means that we have to be able to train our own nurses, doctors, radiographers, ultrasound technicians, and so on. We have to repatriate some of this $250 to $300 million of healthcare spend that we are putting into the South Florida economy. Bahamians, unfortunately, still have this belief that it's better at Jackson Memorial Hospital or Baptist Hospital, except when it's an emergency, at which point in time they will show up in the emergency room at Princess Margaret Hospital or Doctors Hospital or the Rand Memorial Hospital. As I conclude, I mentioned that we have 31 patients in the emergency room at Princess Margaret Hospital right now waiting for a bed, and 24 boarders who have lived in the hospital, some of them for as long as 15 or 20 years. It means that we now have to completely rethink our approach, and we have to make some changes. So I'm going to quickly outline what some of those changes will be. One, we need to find a way to move the boarders out of the hospital. That'll free up 24 beds. We need to complete all of the renovations that were started and never finished. That took 67 beds out of commission. We need a whole new emergency room. We need to outsource some of the services from the hospital so that we can free up footprint. But most importantly, we've got to do things better and more efficient. And it means, for the most part, investing in the critical care services that get people in and out of the hospital quickly, and investing in the community care services that keep them out of the hospital in the first place. That means putting quality, capable, compassionate, competent doctors in the community, increasing home care services, visiting patients at home and making sure that they're getting the care that they need, that they're taking their medicines, that they're eating right, etc. The truth of the matter is that most of the healthcare challenges that we see can be very well explained by the choices that we have made. And Bahamians don't like to hear that. That we have brought this on ourselves. Certainly it's true for violence. Certainly it's true for obesity. Certainly it's true for diabetes and high blood pressure. And it may indeed be true for cancer. That truth is an uncomfortable, inconvenient truth, but it is where we are. And it is looking in the mirror that for the most part determines what's going to happen with your health status. Make different choices, eat better, incorporate some exercise, start to move. And for me, this has been a personal matter because here I am, I'm one of the spokespeople for health. And there was a period in time when I was particularly sloppy, particularly overweight. And, you know, it's a battle that continues every single day, and I think we all have this challenge. And 7, 8 months ago, I made a conscious decision that I was going to change it. And sometimes I'm good, and sometimes I'm not so good. But I realize that the struggle is real for many, many, many people. You add that with video games and the concern about personal safety, and people don't want to go on the street because they don't want to get shot or they don't get run over by a car, and you have a perfect storm. No amount of smooth talk is going to fix this, but I can assure you that we are committed to fixing it. I have also made a determination that it makes sense to at least try to explain what it is we're doing, why we're doing it, even if it may be a little bit confusing the first time we say it. And so we are going to engage in a very aggressive education and information campaign. We have hired a public relations person so that the public is informed via social media and other means what's going on, particularly in healthcare. And I believe that if people understand, then maybe a few more people will get up early in the morning and go for a walk. A few more people will push that extra plate of guava duff away. That maybe we will start to live healthier lifestyles, and perhaps we will solve this problem together. I want to thank the President and your organization for the opportunity to speak to you briefly, and I'll be happy to answer any questions that you may have.
The challenges facing our healthcare system are great. Still, the government remains committed to transforming it because they believe that every Bahamian in every community should have access to quality, affordable health care. And while the Bahamas may have a ways to go before it can become a healthy nation, like every great journey, it begins with the first step. I'm your host, C.S. Scatterly. Thanks so much for watching.